Every day, millions of people are taking medication to manage blood pressure, relieve pain, treat diabetes or depression. But there is a little-known fact. Some of these familiar medications may silently harm the heart. According to several recent large-scale studies, some blood pressure medication for depression and over-the-counter anti-inflammatory drugs have been shown to increase the risk of irregular heartbeat, high blood pressure, and heart attack, especially in people over 60. The danger is that most heart attack symptoms do not appear clearly. They are often just very mild signs such as fatigue, a fluttering heartbeat, or slightly short breath, which are easily overlooked. If you are taking multiple medications every day, especially drugs or long-term painkillers, this video may help you understand the risk. Recognize early signs and, most importantly, know how to adjust in time to prevent a heart attack. In today's content, I will share the 5 most commonly prescribed drugs for older adults and why they may become silent threats to your cardiovascular health. 1. Strong painkillers. The opioid group. When chronic pain shortens your sleep and turns every step into a struggle, many people are prescribed pain medications like oxycodone, hydrocodone, or morphine. These belong to the class of strong painkillers known as opioids, often used for older adults suffering from joint degeneration, sciatica, or post-surgery pain. However, few realize that these drugs are among the medications that cause heart attacks if misused or for extended periods. Opioids can slow the heart rate, suppress breathing, and affect the sympathetic nervous system, disrupting the regulation of blood vessels and heart rhythm. This is especially dangerous for those over 60, as the body's ability to eliminate medication declines and liver and kidney functions are reduced. Many older patients have come to my clinic with prolonged fatigue, shallow breathing, or irregular heartbeat. Upon testing, these symptoms were not just from lack of sleep or low activity, but were early heart failure symptoms caused by opioid buildup in the body. The risk is even higher if the person is also taking blood pressure medications or medication for depression, as the interaction between these drugs can push the heart into overload without any apparent external warning signs. To prevent a heart attack, it is crucial to recognize the risk early and adjust treatment promptly. If you are using opioids, talk to your doctor about safer alternatives like physical therapy, medical massage, acupuncture, or non-opioid pain relief options. Most importantly, do not take opioids for more than 7 consecutive days unless clearly instructed by your doctor. Additionally, physical activity and regular checks of blood pressure and heart rate are key steps to catch any abnormalities early and protect the heart from silent damage. 2. Antidepressants. The SSRI group depression in older adults is common but often overlooked. Life changes like retirement. The loss of a loved one or chronic illness can lead many people to feel sad, isolated, or suffer from persistent insomnia. To address this, many are prescribed medication for depression in the SSRI group, such as fluoxetine, Prozac, sertraline, Zoloft, or escitalopram. However, few people realize that SSRIs do more than just balance brain chemicals. They also impact blood pressure and heart rhythm, especially in those with pre-existing heart conditions. Several studies have shown these drugs may disrupt vascular regulation, leading to elevated heart rate and fluctuating blood pressure, both common causes of heart attack. What makes this more concerning is that the symptoms are often subtle. A person may simply feel mild palpitations, occasional chest tightness, persistent insomnia, or unexplained fatigue without suspecting they're experiencing early heart attack symptoms. Silent heart attacks have been reported in individuals taking high doses of SSRIs for months without regular cardiovascular checkups. The risk increases when SSRIs are combined with blood pressure medications or pain medications, as these interactions may overload the circulatory system. To prevent a heart attack, anyone using antidepressants should regularly monitor their blood pressure and heart rate and notify a doctor if they feel any unusual pounding heartbeat, dizziness, or shortness of breath. It's also wise to combine SSRI treatment with non-drug therapies such as cognitive behavioral therapy, CBT meditation, gentle yoga, or simply walking for 20 minutes each morning, which boosts both mental and cardiovascular health. Depression must be treated, but not at the cost of silently damaging the heart. 3. Diabetes medications. Thiazolidinediones and DPP. 4. Inhibitors. In people over 60, type 2 diabetes is one of the most common chronic conditions. To manage blood sugar, many are prescribed diabetes medications like pioglitazone, a thiazolidinedione, or sitagliptin, a DPP-4 inhibitor. However, few realize that some of these drugs can significantly affect heart health. Specifically, pioglitazone has been found to cause fluid retention, which increases pressure on the heart. When fluid builds up, the heart must pump harder to circulate blood, a strain that can eventually lead to heart failure. Meanwhile, specific DPP-4 inhibitors like saxagliptin have been linked to higher hospitalization rates for heart failure in older patients with pre-existing heart conditions. These effects often do not show up clearly in the early stages. Patients may only notice mild chest heaviness, fatigue while walking, or slight swelling in the legs, symptoms often mistaken for normal aging. In reality, these can be heart failure symptoms or side effects of diabetic medications straining the cardiovascular system. This connection between medications and heart attack is now under deeper investigation, as some drugs may control blood sugar well, but silently overload the heart, especially when combined with blood pressure. Medications, long-term antibiotics, or pain medications. So if you are taking diabetes medications, it is essential to regularly review your prescriptions with your doctor, especially if you notice swollen ankles, trouble breathing while lying down, or a racing heart even at rest. Additionally, you can prevent a heart attack naturally by following a diet low in refined carbs, increasing fiber-rich vegetables, eating smaller portions more often, and staying lightly active after meals, all of which help manage blood sugar and protect your heart in a sustainable, natural way. 4. NSAIDs over the counter. Anti-inflammatory medications. When headaches, joint pain, or arthritis flare up, many people turn to over-the-counter medications like ibuprofen Advil or naproxen Aleve. These are non-steroidal anti-inflammatory drugs. NSAIDs, easy to buy, no prescription needed, and widely considered safe if taken correctly. But here's something most people overlook. NSAIDs can seriously impact heart health, especially in older adults. These drugs reduce the production of prostaglandins compounds that help dilate blood vessels and regulate blood pressure, which can lead to vessel constriction, fluid retention, and increased blood pressure. A study in the British Medical Journal revealed that taking NSAIDs for just 7 consecutive days can raise the risk of a heart attack by 20 to 50%, especially in individuals with a history of high blood pressure or elevated cholesterol. This is one of the most overlooked heart attack side effects, simply because these drugs are easy to get and easy to use, and their adverse effects do not appear immediately. I once treated a patient who had been taking ibuprofen daily to manage joint pain until they were hospitalized with chest pain, shortness of breath, and mild pulmonary edema. They had no idea that the non-prescription medication they had used for 3 weeks was putting severe strain on their heart. If you find yourself needing NSAIDs regularly, it is essential to talk to your doctor about safer alternatives. Some medications safe for seniors include acetaminophen Tylenol combined with physical therapy, hot or cold compresses, therapeutic yoga, or natural anti-inflammatory foods such as turmeric, omega-3, and garlic. Joint pain is real, but like any kind of pain, healing should come from the root, not just by numbing the symptoms while your heart quietly takes the damage every day. 5. Fluoroquinolone antibiotics. No one wants to take antibiotics unless truly necessary, but when facing pneumonia, urinary tract infections, or severe bacterial illnesses, treatment is often unavoidable. Among the most common prescriptions for older adults are fluoroquinolone antibiotics, including ciprofloxacin, levofloxacin, and moxifloxacin, chosen for their broad-spectrum coverage and rapid effectiveness. However, these are also among the most medications that affect the heart if not carefully monitored. This class of antibiotics can prolong the QT interval, disrupting the heart's electrical signaling, which can lead to ventricular arrhythmias, tachycardia, or even sudden cardiac arrest. The U.S. Food and Drug Administration, FDA, has issued official warnings for years, especially concerning individuals over 60 with a history of heart disease, low potassium, or those currently taking diuretics or antipsychotics. Among the dangerous medications for the elderly, fluoroquinolones top the list for causing arrhythmia and hazardous drug interactions. What's alarming is that many people never get an ECG before starting these antibiotics. When symptoms like palpitations, rapid heartbeat, or shortness of breath appear, they often attribute it to fatigue, insomnia, or simply age. In reality, these may be medication side effects in older adults, which, if missed, can result in life-threatening consequences. If you've ever been prescribed ciprofloxacin or levofloxacin, talk to your doctor about the potential cardiovascular risks. For non-urgent infections, consider safer alternatives for the heart, like amoxicillin or cephalexin, especially when treating routine illnesses. Also, request an ECG if you're on fluoroquinolone for more than 3 days, especially if you're already taking heart meds or diuretics. In older adults, being attentive to even subtle changes in the body can be the golden key to preventing cardiovascular emergencies early on. Your heart might not be damaged by age itself, but by the medications that affect the heart you unknowingly take each day. From painkillers, antidepressants, and diabetes medications to antibiotics, any of them could become a threat if misused. Be proactive. Ask your doctor about heart-safe medications. Check your pulse and blood pressure regularly and embrace lifestyle habits that prevent a heart attack naturally by eating clean, sleeping well, and staying active. If this content helped you, share it to help others learn how to avoid heart attacks early. And don't forget to subscribe for more updates on medications, heart health, and senior wellness. Sometimes just being aware means you're already one step ahead in protecting your heart.